Bismillahirrahmanirrahim. In the name of Allah, the most gracious, the most merciful. Narrated by Abu Huraira radhiyallahu anhu, there is no disease that Allah has created except that He also has created its treatment. I'm Dr. Mahnoor, teacher in Department of Community Medicine in King Edward Medical University. Today I'm going to present the topic of medical education under the kind supervision of my professor, Dr. Saira Afzal. In this presentation, we will learn what is curriculum, how the curriculum is being developed, what are the types of curriculum, what is medical education, the SPICE model versus traditional model, medical education in Pakistan, recent advances regarding medical education, and we'll practice few MCQs. At the end of this session, learner will gain insight into the curriculum development, will be able to compare the traditional and SPICE model, will be able to comment and evaluate the Pakistan medical education system in Pakistan. So what is curriculum? A curriculum refers to the structured set of intended learning outcomes, educational experiences, content, materials, and assessments designed to guide and support learning in a specific academic program, course, or educational system. It encompasses the overall plan and framework for what students are expected to learn, how it will be taught. Curricula can vary widely. They generally outline the sequence of topics, the methods of instructions, and resources used to facilitate learning within a particular educational context. Here are the types of steps of designing a curriculum. First of all, we identify and evaluate goals and objective, conduct need assessment, then curriculum is planned, content is selected, in instructional designs is made, assessment and evaluation is done, implementation, evaluation, and revision at the end, continuous improvement. Here are the key principles for curriculum design. It should be balanced, rigorous, coherent, vertically integrated, appropriate, focused, and relevant. Curriculum development process is a systematic process that involves designing, creating, implementing, and evaluating an educational curriculum. This process aims to meet the learning needs of students, align the educational goals, and continuous improvement based. Here are the steps of this process. Needs assessment and analysis at first, then objectives and goals are setted. Curriculum design is planned. Content selection and organization, instructional methodologies and strategies are opted. Assessment and evaluation planning is done. Implementation, rollout, monitoring, evaluation, revision, and at the end of documentation is done. So here is our curriculum development process. First of all, we analyze and research for that curricula, then design the curricula, then development according to design is made. Then according to development, implementation is done, and at the end, evaluation is done. And after evaluation, we again analyze, and the process keeps on going. It's a current model which is used for the development of our curriculum. In this, first of all, we identify objectives, select the learning experiences, organize the learning experiences, then evaluation is done, then implementation is done, and at the end, revising means it keeps on going. Here are the few types of curriculum as subject-centered curriculum, learner-centered curriculum, activity-based, interdisciplinary, core curriculum, hidden curriculum, spiral, democratic, problem-based curriculum, transdisciplinary curriculum. First of all is subject-based curriculum. Curricula organize learning around specific subject or discipline. Learner-centered curricula is that which prioritize the individual student needs, while activity-based curriculum is that which emphasizes learning through the activities, projects, and hands-on experiences. Here are a few examples. In subject-based, only one subject-based curriculum is designed. In learner-based, is depend on the student, and activity-based curriculum with different activities, the curricula is proceeded. Interdisciplinary or integrated curriculum combine multiple subjects or disciplines into a unified learning experiences. These approaches show how different areas of study relate to each other in real world. Core curriculum include a set of common subjects or courses that all students are required to take regardless of their major field. Hidden curriculum refers to the unintended lessons or values that students learn from the school or environment. Is interdisciplinary curriculum in first diagram where different discipline may participate, and core curriculum is the specific subjects which are being included along with your specific curricula, and there is hidden curriculum in which passive learning is done. 7.1 is spiral curriculum. Curricula introduce topics at a basic level and revisit them gradually, increasing the complexity and depth over the time. 8.1 is democratic curriculum. Curricula focuses on fostering critical thinking and special responsibilities and activities in citizenship. It aims to create informed and engaged citizens within a democratic society. Ninth one is problem-based curriculum. Curriculum that uses real-world problems as starting point of learning. Students work on complex problems, allowing to integrate different subjects and encourage critical thinking and problem-solving skills. His spiral curriculum, which is started with a basic learning or knowledge and is spiralate over the time. His democratic curriculum, in which individual democracy is strong, and last one is problem-based curriculum, which we apply also in research. Last one is transdisciplinary curriculum. Curricula go beyond the interdisciplinary approach by integrating various disciplines into a holistic, unified framework. This type of curriculum aims to address complex real-world issues without constraints of traditional subject boundaries. Now we will move on the medical education. Medical education is the process through which individuals, typically aspiring doctors and healthcare professionals, acquire the knowledge, skills, and competences necessary to practice medicine. It encompasses the formal training and learning experiences required for individuals to become physicians, surgeons, nurses, pharmacists, and other healthcare professionals. Here are the components of medical education. There are undergraduate medical education, preclinical and clinical training, residency and specialty training, continuing medical education, CME, clinical rotations and clerkship, licensing exams, research and publication opportunities, professional development and continuing education, clinical experiences and internship, clinical skills and stimulation training. His SPICE model, which we is now being applied in medical education curricula. The SPICE model, in the context of educational strategy, is framework used to design and develop effective educational strategies, especially in the field of medical education. Each letter in the acronym represents a key element considered when devising educational strategy. S goes with student-centered learning. P goes with problem-based learning. I, integration. C, community-oriented learning. E goes with elective and enrichment. S goes with systematic approaches to teaching. Here's the comparison between traditional curriculum, which is being followed previously, and SPICE model. In traditional model, there was teacher-centered learning, while in SPICE model, there is student-centered learning. In traditional, information was gathered, while in SPICE, problem-based learning is done. In traditional curriculum, discipline-based learning was done, while in SPICE there is integrated one. In traditional, hospital-based learning was done, while in SPICE is community-based. Traditional standard programs were followed, while in SPICE there is elective one. In traditional apprenticeship based opportunistic opportunities were given, while SPICE model goes with systematic opportunities. Medical education system in Pakistan. Structure of medical education system in Pakistan consists of undergraduate medical education, postgraduate medical education, professional development, and continuing education, and then medical regulatory bodies which regulate this all. In undergraduate medical education program, we consist of MBBS program, BDS program, which is of Bachelor of Dental Surgery, BSN program, Bachelor of Nursing, PharmD, Doctor of Pharmacy, and DPT program. In postgraduate medical education, we can include the residency program and fellowship program. In residency program, after completion of MBBS degree, doctor pursue residency program in various medical specialties. In fellowship program, subspecialty training following the residency for further specialization in a particular area of medicine is done. Third one is professional development and continuing education. It includes the CME, continuing medical education, and clinical practice and licensure, ongoing education and skill development for practicing physician and healthcare professional, keeps professional updated with latest advancements and medical science and healthcare practices. While in clinical practice and licensure, upon completion of their education and training, medical professionals obtain licenses from PMC or PMDC to practice medicine. Fourth one is the medical regulatory body, which is nowadays PMDC, Pakistan Medical and Dental Commission, oversees medical education, sets standards, accredits medical colleges, and regulate medical practices in Pakistan. This structured educational pathway in medical education in Pakistan provides a comprehensive foundation for future healthcare professionals from their initial undergraduate studies through specialization, training, and continuous professional development. There are two types of medical institutions in Pakistan. One is public medical colleges, second one is private medical colleges. Pakistan has numerous government funded medical colleges. Some well-known are King Edward Medical University, Rawalpindi Medical University, etc. Private medical colleges, in addition to public institution, there are private medical colleges such as Shalimar and so on. These are the challenges and reforms which are being faced in medical education system in Pakistan. First one is quality of education. Ensuring uniform quality across institutions remains a challenge. There have been concerns regarding the standard of education, availability of resources, and discrepancies and training among various medical colleges, accreditation and oversight. Regulatory bodies like PMC, PMDC oversees medical education and have faced challenges in ensuring standardized curricula, proper facilities, and faculty qualification. Clinical training and infrastructure. Access to quality clinical training and facilities varies across the institution, leading to disparities in the practical exposure students receive. Faculty development. Developing and retaining qualified faculty member is crucial. Effort have been made to enhance teaching standards and promote faculty development program. These are the recent changes and initiatives which are being taken to improve our medical education system. Curriculum reform. Some institutions have introduced modern teaching methodologies like integrated curricula and early clinical exposure to improve the educational experiences. PMDC reformation, quality assurance. There is a growing emphasis on enhancing quality assurance mechanism, accreditation process, and continuous monitoring of medical education standards. Research and innovation efforts are being made to encourage research and innovation in the field of medicine, aiming to advance healthcare practices and technologies within Pakistan, and we are seeing all this in our department too. Conclusion. Medical education in Pakistan is evolving, aiming to meet the global standards and address the diverse healthcare needs of population. Initiative for curriculum reforms, faculty development, quality assurance, and technologies integration and pivotal in shaping a more robust and standardized medical education system in the country. Ongoing improvement in infrastructure, teaching methodologies, and regulatory frameworks are vital for producing competent and compassionate healthcare professionals capable of meeting the nation's healthcare challenges. Now, recent advances. This article has been taken from the Pakistan Journal of Medical Sciences, uh, with the name of with the title of Challenges Towards Quality Assurance of Basic Medical Education in Pakistan. Objective of this article was to focus on growing concerns towards quality of medical education in Pakistan to help strengthen accreditation process. This study identifies the challenges towards quality assurance of basic medical education in Pakistan. Uh, Data identified 14 sub-themes grouped under three major themes. Challenge toward quality assurance included mounting political influence, commercialism in medical education, weak regulatory capacity of accrediting body, violation of rules, lack of valid accreditation standards, and skilled inspector. Here's an other study which has been taken from the Journal of College of Physician and Surgeon, Pakistan, um, uh, with title of Challenges of Outline Medical Education in Pakistan during COVID-19 pandemic. Medical colleges and university were facing challenges to provide quality education to their students during the prolonged period of lockdown. These include the lack of quality training and institutional support, internet connectivity issues, maintaining student engagement, online assessment, and problem with understanding the unique dynamic of online education. Our collaborative approach involving all stakeholders, institutional support, use of free online training resources, and out-of-box thinking can help overcome these challenges. Now, the time of MCQs. First one is in context of curriculum development, which step involves continuous reviewing and improvement based on assessment data, teacher feedback, and evolving educational trends. Alpha needs assessment, beta implementing, Charlie evaluating, delta selecting learning experiences, eta revising. Anyone?
C. C.
The answer is A, revising. A medical college introduced an educational approach focusing on engaging students in hands-on learning experiences and real-world problem-solving activities. Which type of curriculum does this new approach represent? A, learner-centered, B, subject-centered, C, activity-based curriculum, D, core curriculum, A, interdisciplinary curriculum. Anyone? Here is mentioned hands-on learning. So it would be C, activity-based curriculum. Third one is in a medical school environment, students learn ethical behavior, communication skills, and professional conduct through observing their mentors and interacting with colleagues. What aspect of educational environment does it represents? A, subject-centered learning, B, formal curriculum, C, hidden curriculum, D, structured clinical training, E, problem-based learning.
E.
The answer is C, hidden curriculum elements, because they are mentioned the communication skills, professional conduct, and all we learn through passive learning. Fourth one is what is the primary focus of SPICE model in medical education for guiding learner through clinical cases and problem solving? A. Enhancing traditional lecture-based learning. B. Focusing on individual discipline mastery. C. Encouraging interdisciplinary interactions. D. Structuring hidden curriculum experiences. E. Facilitating structured problem-based approaches.
E.
J. Answer is E. Facilitating structured problem based approaches. Fifth one is in a conventional medical curriculum, students primarily engage in lecture based learning, memorizing facts, and attending theoretical classes. Which curriculum type best characterized these approaches? A. Learner centered. B. Activity based curriculum. C. Subject centered. D. Interdisciplinary. E. Problem based curriculum.
C.
G. C. Subject based. Sixth one is during clinical rotation, medical student encounter a patient exhibiting symptoms of fever, cough, and shortness of breath. This spice model component involve identifying the problem exhibited by patient. A situation, B problem, C implication, D choice, E evaluation.
B.
B. The answer is B. Problem. Seventh one is as part of a curriculum development team, you are tasked with reviewing the existing educational program for medical students. Which phase of curriculum development involves analyzing the current educational goals and learning objectives? A. Assessment. B. Plan. C. Implementation. D. Evaluation. E. Design.
A.
A. Assessment. A medical college introduces an educational approach that emphasizes a problem solving orientation, integrating clinical cases into the learning process. Which curriculum type aligns with the approach? A. Subject centered curriculum. B. Learner centered curriculum. C. Activity based curriculum. D. Interdisciplinary curriculum. E. Problem based curriculum.
D.
There is E. Problem based. Problem solving, emphasizing on a problem solving orientation. Ninth one is a group of medical graduates are seeking further specialization in a particular medical field after completing their MBBS. What phase of their medical education is this? A. Undergraduate medical education. B. Clinical rotation and clerkship. C. Residency program. D. Continuing medical education. E. Postgraduate fellowship program. After
D.
MBBS? Yes, C. Last one is in Pakistan, which regulatory body is responsible for overseeing medical education, setting standard, accrediting medical colleges, and regulating medical practices? A. PMDC, Pakistan Medical and Dental Council. HECP, Higher Education Commission, Pakistan. C. WHO, World Health Organization. D. PMC, Pakistan Medical Commission. E. MDCAT, Medical and Dental College Admission Test.
PMDC.
GPMDC. Here is the key of MCQ. It is the link of our YouTube channel where all presentation are being posted. Kindly like and subscribe. Thank you so much.